Hey there, Todd Cameron here, GP and co-founder at M3 Health. Today I want to chat to you about telehealth and the introduction of telehealth by the federal government was as a direct result of the pandemic, and COVID has taken a lot away from us, our way of life. Many people have lost businesses and in some cases lives, of course. So a serious impact on our community, and none more so than Melburnians. The federal government, did put together Medicare support for telehealth services back in March of this year to try and assist patients with receiving care outside of the clinic environment. We've now been doing those for 6-7 months and we've become really proficient at them. So the good news is that we will have telehealth as a future offering in all of our practices. During the pandemic up until now, we have made all of those services available free at the point of care. That means that those services were bulk billed. They will now be shifting to the normal fee structures that you would expect for an in-person consult. But I just want to remind you of the benefits of telehealth. So if you call your accountant or your lawyer or you visit them in person, you'll be paying the same price, and that's because on the other end of the phone is a person that is an expert that understands your needs particularly well, and it's the same brain, the same information that you are paying for. The same thing is true in medicine. So when telehealth is used to augment existing services, not as a complete replacement of services. And the way that we look at this at M3 Health is there are really three types of consultations. There are a group that are, we're going to say they're green lights, like they're clearly able to be done by telehealth. There's a group that are orange where you think, maybe they should be seen in person, or under certain circumstances, if this or that changes, we probably should see you face to face. And then there's a group of consults that just clearly need to be seen face to face. Examining a skin lesion, examining somebody with abdominal pain, doing a full assessment. There's a lot of things that have to be done face to face. And the outliers are pretty easy. The green and the red are easy. It's the ones in the middle where there's a little bit of a hassle. However, what telehealth has given to our patients is time and flexibility. All of our telehealth to date has been offered on the telephone, and that is for one simple reason. It is easy, it is reliable, and it is mobile. So you can take it with you anywhere. You can have a telehealth consult where you're going for a walk. Obviously, you can do that in any location where you can use a telephone, and it doesn't depend on technology. You don't need an app. You don't need bandwidth. All of those things are taken out of the equation. So at this point in time, we do not offer video telehealth consultations, although we will be presenting those to you later, and that will be a premium service. So the telephone telehealth consultations are at the same price of an in-person consultation, but you get to save the amount of time that it takes you to prepare, jump in your car, drive to the practice, find a park, sit in the waiting room, check in at reception, all of those things, and then the reverse to go backwards. And in most cases, that's probably 1 hour of your time, and you can conduct a consultation from the comfort of your living room or your office, your workplace, whatever is convenient to you. So you will have a choice about coming in or having telehealth consultations from home, but we are really excited about the patient-centric model of care that this helps us to deliver, and where appropriate, we'll be suggesting that people avail themselves of telehealth consultations. And when it's appropriate, we'll get you in here. And when you come in, you'll notice that the environment is completely redesigned for COVID. It is only in a safe environment that we see you. Our primary objective is to protect you, our patients, and make sure that you, your community, our community, and your family are safe. And we look forward to continuing to provide those services for you. Thanks. I've been Todd Cameron. Bye.